Welcome, I am Terry Tropin, and today I'm discussing the basics of current procedural terminology coding, usually referred to as CPT. First, let me tell you a little about myself. I have a master's in healthcare administration informatics from the University of Maryland Global Campus and have RHIA and CCSP certifications. I am also an AHIMA-approved ICD-10 trainer. I've taught health information technology at Montgomery College for over 20 years. And I've also written books on coding. These books are study guides that summarize the confusing and complicated coding guidelines. My books include one on E&M coding, ICD-10-CM coding, ICD-10-PCS, and external causes. These are available on Amazon. If you enjoy this video, be sure to hit the like button and click on my picture in the lower right-hand side to subscribe. Here's an overview of what I'll be discussing today. First we're going to talk is, what is CPT? When do you use ICD-10-PCS and when do you use CPT codes? Who can report CPT codes? Then there's discussion of CPT code categories, what they are, and then an intense look into Category 1 codes, and then a brief look at Category 2, Category 3 codes. So what is CPT? CPT is published by the American Medical Association since 1966, and it was developed specifically for reimbursement purposes, unlike, as you may remember, ICD-10-CM, which was developed internationally for monitoring, tracking diseases. So this CPT was developed specifically for communication between providers, including doctors, and third-party payers. It enables the comparison of reimbursement amounts. So if you know if code A is worth X amount of money payment and code B is worth another set amount, because the amount of reimbursement for each one is set for the year, you can compare the two. Why is this one more? Why is this one less? Which is more complicated, risky, etc. It also speeds up the processing of claims. So you send a code number to the provider. They say, okay, this code is worth X amount of money, and the money hopefully gets sent back. Now this can also be used for data, to collect data on trending and planning like ICD-10 is, but that's not its primary purpose. Now a new edition of CPT comes out and is effective January 1. In the official publication, if you have questions, if there's something that's not clear in CPT, the official publication is CPT Assistant. If it says that's how a code is interpreted in the CPT Assistant, that's how it's interpreted. So it's the final rule on this, on using CPT. So a question I often get from my students is, when do I use CPT and when do I use ICD-10-PCS? Okay, a lot of times a student will be taking ICD-10 and CPT at the same time and get confused about when you use what. So facilities use ICD-10-CM for diagnoses and ICD-10-PCS for procedures. So that's what the hospital is reporting, okay? The providers of the service, of the professional service, use ICD-10-CM for diagnoses, but they use CPT codes for their professional services, for their fees. So you have the hospital reporting codes and the person who provided the service within the hospital reporting different codes. And of course, a physician in a private office or clinic that they own will be using CPT codes. Who can report CPT codes? This is established in the Introduction to CPT, which says codes can be reported by a physician or other qualified healthcare professional. So what is a qualified healthcare professional? Well, that could be an advanced practice nurse, physician assistant when they're working with a physician, a nurse, an anesthetist, a nurse midwife. But there are rules, and these may vary, unfortunately, from state to state. They must be qualified by education, training, licensing, and regulations, and the facility rules to provide the service. And again, this may vary. And it must be within the scope of practice, the limits of their practice for their licensing. So CPT codes are divided into 3 categories: Category 1, Category 2, Category 3. Most of the ones that you'll be most familiar with are Category 1 code, and that's the focus of this video. I'll talk briefly about Category 2 and Category 3, but the main focus of coders and this video are Category 1 codes, the main part of the book. So what are Category 1 codes? These are codes for procedures and services, and they've been reviewed by the CPT editorial panel. This panel includes 17 members, including physicians from different medical specialties, representatives from the American Hospital Association, insurers, and representatives from osteopathic medicine. The panel meets 3 times a year to consider new codes and changes to current codes. In order to become a code, the procedure must be, or service must be, performed by many healthcare professionals in clinical practice in multiple locations, and if appropriate, if it needs FDA approval, it's been approved. So those are the codes that go into Category 1 code. So these meetings make sure that it meets the criteria. So within Category 1 codes, you have 6 sections. These are evaluation and management codes, and this is codes 99201, 99499, and I have separate videos that talk specifically about evaluation and management. Have anesthesia, surgery, which of course is the largest part of the book, radiology, pathology and lab, and medicine. Each of these sections is divided into, so you have a section, then a subsection, then a heading, then a subheading, then notes and guidelines for that subheading, and then specific codes. The reason this is important is that you can find guidelines for the whole section, for just a subsection, for just a heading, etc. So first, let's look at the symbols used in CPT. These are used throughout the book. First, we're going to talk about parentheses. That's these. And these are referred to as parentheticals. They contain important information about coding for a specific code, and they are listed after a code. So here's an example. Code 13160, secondary closure of surgical wound or disheasance, extensive or complicated. There's a note under that that says for packing or simple secondary wound closure, C 12020, 12021. So this is saying if this is not extensive or complicated, use these codes instead. So that's really important information. The next symbol is a semicolon. This is used to save space in the CPT book by not reprinting all the wording for a code for the similar codes. But this can be confusing. The main code, which in the example is this one, is often called the parent code. These codes indented under it, you can see they're indented, are called the child codes. So we have 64400, injection anesthetic agent, trigeminal nerve, any division or branch. Then under that you have indented facial nerve. So here is the semicolon. So all of this information before the semicolon is included in this code and in this code and in this code. So 64402 includes the information from 64400, injection anesthetic agent, but then it lists a different nerve. For 64402, it's a facial nerve. For 64400, it's a trigeminal nerve. So each one of these is a different nerve. 64405 is the greater occipital nerve. So you know, so instead of writing this part of the code over and over again, they just indent. Note that the wording for this 64402 is not included in 64405. So it's just the part from the parent code, this one, that is included in the child codes. The next symbol is a circle, dot, bullet, referred to in different ways. This symbol indicates this is a new code for this year. Now here's an example from this year. 69705, nasopharyngoscopy, surgical with dilation of eustachian tube, unilateral. So this symbol lets you know this is a new code. You may have been reporting this as an unlisted code or using a different code for that, but now you have this code for a nasopharyngoscopy. The symbol is used only for the first year it was added. So for 2022, this is not going to have a bullet. And all of these new codes are included in Appendix B of your CPT book. So that's a good place to look when you first receive your new book. Look at Appendix B to see what's new. It's a summary of everything that is new. So the next symbol is a triangle, an upright triangle. This indicates that the code description has been changed. For example, lots of changes were made to the evaluation and management codes this year. So you see what's been crossed out, what the change is. 99203, they crossed out these three key components, and they crossed out all of this down here. But they added the part that's underlined, they added this part, okay? And these are also listed in Appendix B of your book. And the symbol is only used in front of the code for the year it was changed. So this year, there'll be a triangle in front of the code. But next year, there will be not, because it's no longer new for this year. This symbol is sideways triangles. Okay, the other one was an upright triangle, and this is a sideways triangle, and there are two of them. So what this means that is the triangles are enclosing words that have changed, okay, for this year. So under code 37245, there's the new note says, do not report 37248 to 37249 in conjunction with 0620T, which is a category 3 code, within the tibial peroneal segment. Now, last year, it says do not report. Okay, that's all the same. And this is changed, and this is changed. So that's what is different between the new note and the note from last year. Now, this was changed because 0620T, the category 3 code, was not in the 2020 CPT book, so it was not an option. And also the segment involved is changed. Popliteal or peroneal. Now here's another example of using of the sideways triangles. In this case, the change has been made to a guideline. For example, for combined arterial venous grafting for coronary bypass, you have procurement of the saphenous vein grafts, including the description of the work for 33517, 33523. In 2020, it said procurement of the saphenous graft, including the description of the work for, see, this was changed. Okay, so that's where the change was. Sometimes you have to really read it carefully to find, you know, where the heck the change was, but that's where it is. Now again, these symbols are used only in the year the change was made. So for 2022, it's not going to have these around the new wording. It'll just be there. The next symbol is the plus sign. This indicates an add-on code, meaning they're always listed with another code. They're listed, another code is listed first, and this code is listed second. For example, 52441 cystal urethrostomy with insertion of permanent and adjustable transprostatic implant, single implant. That's 52441. Now, underneath that is 52442 for each additional permanent adjustable transprostatic implant. And it says list separately in addition to code for primary procedure. Note that it says each. So if 2 implants were done, you're going to code 52441 and then 52442. If 3 implants were used, you're going to do 52441 and then 52442 times 2, because there are 2 additional implants, and you're coding the add-on code for each. Now this symbol stays with the code as long as the add-on code exists. So it'll be the same. It'll be in 2022, it'll still be there. Now a list of these add-on codes is included in Appendix D. The next symbol we're going to talk about is the null sign, a circle with a slash through it. This means the code is not subject to the multiple procedure reduction in payment. Modifier 51 is used on the second procedure when more than one procedure is performed, in most cases. This is important because in most cases, payment for the second procedure is reduced. This is because when 2 procedures are performed, there is not twice as much time in the operating room, twice as much nursing care, twice as much pre- and post-operative care, etc. So in most cases, when the modifier 51 is used, a procedure may be paid at $100 and the second one at $50. When both are performed together, the first is paid at the full $100, but the second usually at $25, which is half the usual payment. It's approximately 50%. It may vary according to with different payers. So this symbol is really important when you're trying to figure out how much you're going to get paid for something. This means that this code's not going to be reduced when it's the second procedure. So you have 44500, which has this symbol in front of it, introduction of long gastrointestinal tube. And so that is not subject to the reduction when performed with something else. And again, there's an appendix that lists all of these 51 modifier 51 exempt codes. That's Appendix E. So next we see the number or hashtag symbol. This means the code has been moved within the book and is no longer in numerical order. They refer to it as resequenced. This will drive you crazy trying to find a code and then going back and trying to find where it's been moved to. Code, why are they moved? Well, they're moved so that they're grouped together similar codes. For example, codes 50430, 50437, injection procedures for nephrostogram and or uretherogram and placement of catheter, were moved from the section with 50390, they were moved to 50390, 50405. So why? Well, originally they were in the heading for repair, which they're not, they're an injection. So they're moved to a section with other introduction, injection, change. So this is why they were moved. So they're with other codes for injection. Now, at where it would be numerically, 50430 after 50425 or 29 or whatever that code is, there'll be a note saying, hey, these are moved, it's out of numerical sequence, and it will refer you to the codes where it's been moved to. So it'll say 50430, 50437 have been moved, and this is where they're being moved. Now also this symbol will stay in the code year after year because it's been moved, and it will be listed in its new place every time. And there is a list of resequenced codes in Appendix N. Okay, the next symbol is a star. And this means the procedure may be performed using telemedicine. It may be performed face-to-face, or it may be performed using telemedicine, meaning through audio and video means the patient and the provider are not in the same room. Okay. This is used with some E&M codes, evaluation and management codes, and codes in the medicine sections. So if this service is being provided using telemedicine, you need to add a modifier 95. Synchronous telemedicine services rendered via real-time interactive audio and video. Patient and healthcare professional were not in the same location at the time of the encounter, but communicated through audio and video means. Okay. Now, sometimes it'll be provided face-to-face, and in this case, you're not going to use the modifier 95. But if it's done using telemedicine, you will use the 95 modifier. Now, this list will probably not change every year. I don't know if something will be moved to something provided using telemedicine or not, but it's possible. But generally, they'll be the same year to year to year. And a list of these codes that can be used for telemedicine are in Appendix P. Okay, the next symbol is this one, and that's the best I could do with possibilities online. It's not exactly what the symbol looks like. But this symbol indicates a vaccine or other drug has not yet been approved by the Food and Drug Administration. Now, the problem is drugs are approved throughout the year, okay? But CPT is only printed once a year. So a drug may be in the process of approval, but not yet officially approved. If it's approved sometime during that year period, the AMA will post that information on its website, and here's the place where you can find that. So if you want to do one of these codes, you need to check to see if it's been approved yet. So here's an example. In 2021, 90666 influenza virus vaccine, pandemic formulation, split virus, preservative free for intramuscular use. Okay, that one has that funny symbol in front of it. And of course, this list will change every year because a drug will either be approved or not approved, and then new drugs will be put onto this list. So this will vary every year. And all of the ones that are pending approval are listed in Appendix K. The last symbol is an arrow in a circle, and this is used to provide references to other materials outside the CPT book. So it's listed under a code, and for more information about that code, you can go to CPT Assistant, another document, CPT Changes in Insider's View, or Clinical Examples in Radiology. And these are all AMA references. So if you want more information on how to use the code, this is where you go if you can have access to these resources. Okay, let's move on to CPT guidelines. We will discuss these where they're located in the guidelines, since they vary by sections, subsections, headings, subheadings, or coding. So that's what makes it confusing, is that they're all over the place. They're not grouped together like ICD-10 guidelines are. Note that the guidelines from one CPT section don't apply to another CPT section. So if you go to the surgery section, there's pages of surgery guidelines at the beginning of the sections. And these apply to all the codes within this section, but not to codes in other sections like anesthesiology or E&M services, okay? Now, it's also, if you have a subsection of digestive system, bariatric surgery, laparoscopic, there'll be guidelines there, and those apply to all codes in that subsection. So it's only for the section where you find the guideline or the subsection. So guidelines that are found in all sections. For example, the section surgery, which is the largest section of CPT, there are lots of guidelines written at the very beginning of this section. These guidelines discuss the CPT global surgical package, follow-up care, separate procedures, unlisted procedures, special reports, imaging guidance, surgical destruction, and there also has a list of all the subheadings in this section. Of course, these guidelines apply to all of those subsections within the surgery section. Now, I should say that this is very confusing and complicated, and I have another video on that subject if you want more information. Okay, there are also guidelines in subsections. So for example, in the section surgery, there's a subsection for musculoskeletal system. At the beginning of that subsection, you have definitions of what's closed treatment, what's open treatment, definition of percutaneous skeletal fixation, definition of manipulation, and a definition for excision of types of tumors and what types of tumors are coded where. So this is important information. This applies only to this subsection. There are also guidelines only in headings. For example, so we have the surgery section, digestive system, and then a heading, vestibule of the mouth. So here's a guideline, it's more of a definition that says, well, what is the vestibule of the mouth? The vestibule is the part of the oral cavity outside the dentoalveolar structures, includes mucosal and submucosal tissue of lips and cheeks. So the vestibule of the mouth includes the lips and cheeks and the other structures there. So that gives you a guideline of when do you use these codes. Now, there are also guidelines specific to a subheading. For example, we have section radiology, subsection diagnostic ultrasound, the heading is pelvis, and the subheading is obstetric. Now, this has some really important information because this defines what's included in a code. How do you differentiate between a complete, limited, follow-up ultrasound? And this tells you. So for 76801, 76802, it includes determination of the number of gestational sacs and fetuses, gestational sac fetal measurements appropriate for gestation, and it goes on and on. It's very, very specific. So this is very important. So finally, guidelines may apply only to a specific code. For example, we start with the surgery section, respiratory system, lungs in plural, incision, and then you get to this code, 33096, thoracotomy with diagnostic biopsy of lung infiltrates. And there's a note under here, do not report 33096 more than once per lung. Okay, so that comes back to one of those parentheticals we talked about before, but it's used for guidelines on how to use this code. Now, you also will see within the surgery section and also within other sections, unlisted procedures and services, and these are listed in the introduction to a section. Here are the unlisted procedures and services for that section. So what are these? Well, when there's no specific code for the service you're looking for, you do an unlisted procedure. You'd think with all the codes that are in there that something would cover it, but not necessarily. When that happens, use an unlisted procedure code. Now, unlisted procedure code, what does that mean? You know, unlisted. What does that tell the payer? How does the payer going to determine how much to pay for that? Well, what you need to do is to provide some information, like a copy of the procedure report, a letter from the physician to explain this is an unlisted procedure, but this is what we did. This is what happened, and that will justify an amount that you asked, amount of payment. So here's some examples of unlisted procedure codes. Note that they all end in a number 9. So you have 25999, unlisted procedure forearm or wrist, 44799, unlisted procedure intestine, 58679, unlisted hysteroscopy procedure uterus, 68399, unlisted procedure conjunctiva. So they all end up in 9. And you can see if you turned in a claim with 44799 on it and no further explanation, the payer has no way of determining what this procedure was worth. That's why you need to give additional information. Okay, now let's move on to using the CPT index. The index lists main terms that refer you to the correct CPT code in the main part of the book. Now, there are many different ways to look up a code in the index. You can look up the service or procedure that was performed. Was it a repair? Was it an excision? You can also look up the anatomical site. You can look up elbow, okay, or a medial nerve. You can look up the condition or a disease that the CPT code was performed for. It was performed to repair a cleft lip. You can look up cleft lip. It might be a synonym. You can look up toe, or you can look up interphalangeal joint. It might be an eponym, Jones procedure, Heller operation. Although go back and look at the code and make sure that they're not two different Jones procedures, one of which is very different than the other. Now, there are also some abbreviations in the index, like ECG or PEEP, pressure breathing positive. So my usual recommendation is to look up the procedure being performed. And we're using the index, look up what you think it's going to be, and if that's not satisfying, if that doesn't give you something that sounds right to you, think, how else can I look this up? Maybe I should look it up by the anatomical site instead of the procedure. Maybe I should look it up by what it's being done to treat. So think about it. If what you get, it doesn't seem quite right, look it up a different way and see what you come up with. So main terms in the index are listed in bold type, and listed under the main term are subterms with more specific information. So in order to find a code, look first in the index, then refer to the code in the main part of the CPT book. This is important because remember all those notes and guidelines and symbols we discussed earlier. If you don't look into the main part of the book, you're not going to see them, and you won't have those that will help you make sure you're selecting the correct code. This is a view of an index entry. So you have glenohumeral joint, and then you have this is the main term, and you have arthrodesis and arthroplasty. So the subterm to this is arthrodesis, one of the subterms. This refers you to two codes separated by a comma. This means that the code you need is either 23800 or 23802. So you have to go back to the main part of the book and look at those. Another subterm under this entry is arthroplasty. This lists 23470 and then comma 23472, 23474. This means that the code might be 23470 or 23472, 23473, or 23474. The dash here means a range of codes. This means a single code, and this means a range of codes. So in the middle of this is 23473, so it might be that one too. You have to go back and check it in the main part of the book. So even if you go into the index and there's only one code listed, still go back to the main part of the book and check, look for notes, and make sure that you've selected the correct code. Here's a practice on finding a code. So we are looking for a code for an open biopsy of the kidney. The main entry, biopsy, which is here in bold, refers you to a range of codes, 50200, 50205. There's a subterm for endoscopy, which refers you to another code. Now we look back at this and we say, oh no, it's not this one, because this is an open biopsy. So we're going to look up these series of codes in the main part of the book. And you see, well, 50200 can't be right because that's percutaneous and this was open. So that leaves you with 50205, and that's the correct code. There also, we talked about a number of appendices in this video, and there are others that you might be interested in that could be useful to you. I think the most useful one is Appendix A, list of modifiers and their descriptions and when to use them. This is really important. In fact, I'm probably going to have to do a video on modifiers, CPT modifiers at some point, because they can be complicated. Although some modifiers were discussed in the video I've already done on the global surgical package. There's also Appendix C, which is clinical examples for codes found in the E&M section, the evaluation and management section. So that's code, and it says, for example, this might be used for this circumstance. So it kind of helps you think through how this should be. Now, we didn't talk about Appendix F and modifier 63. So this lists codes exempt from modifier 63. What's modifier 63? This means that procedure performed in infants less than 4 kilograms, which is a little less than 9 pounds. And again, if you have a small infant, the procedure is much riskier and more delicate than a full-grown person or even a teenager. Most of the codes you will use are the Category 1 codes we just discussed, but also there are Category 2 and Category 3 codes. So Category 2 codes are called supplemental tracking codes, and these are used to report performance measures, and they've been established by medical societies. So a medical society will say an annual exam should include da-da-da-da-da. An evaluation for osteoporosis should include these components. Okay, so they're used to make sure quality of care was being provided. So CPT says that these Category 2 codes are to decrease the need for record abstraction and chart review. So you have it out there already. You don't have to go through all of them and find whether or not something specific was done that doesn't have a separate code. It increases the data collection about quality of care, and it will track whether nationally established performance measures are being met. So these national established measures are done by either the federal government or by national medical organizations. So Category 2 codes are optional. You don't have to use them. They cannot be used to replace a Category 1 code. If a Category 1 code exists, use that one. So how do you know if it's a Category 2 code? Well, it's easy. They have 4 numbers and a final digit F. So here's some examples. 0502F, subsequent prenatal visit. 3077F, most recent systolic blood pressure greater than or equal to 140 millimeters. Anyway, so this gives you, this is very precise. So this says blood pressure, systolic blood pressure was measured, and it was at this range. Okay, so it's very specific information in some cases. So for more information about Category 2, you can find, you can go to AMA. Okay, then another category of codes are called Category 3. These are used for new technology or new procedures not proven as yet. They're not proven, so they can't be part of the main part of the book, the Category 1 codes, but they want to test them out, see how many people are using them and what the outcome is. And in order to track that, you have to use the Category 3 code. These codes are not optional. So these are temporary codes. After 5 years, they may either be added to Category 1 codes. They said, hey, this procedure is great, we want it as a regular code, or not so much, we're going to delete it, okay? And this is to evaluate services not now approved by FDA to find out whether they are effective or not. So these codes, as I said, are not optional. If a Category 3 code exists, use it. So why? Because this allows tracking of the procedure in order to evaluate whether or not it's effective. So these codes include 4 numbers and the final letter T. So we had 0071T, focused ultrasound ablation of uterine leiomyomata, including MR guidance, total leiomyomata volume less than 200 cc's of tissue. And you'll note under the code, it gives you sunset, when it will be deleted, the 5 years, unless it's so fabulous that they move it earlier. 0198T, measurement of ocular blood flow by repetitive interocular pressure sampling with interpretation and report. And again, that has a sunset date under it. So these are some examples of Category 3 codes. So what happens after 5 years? Okay, so 0058T, cryopreservation reproductive tissue ovarian. It says in Category 3 section, this was deleted 12/31/20. And it also says use code 89398, unlisted reproductive medicine lab procedures. So they decided not to make a separate code specifically for cryopreservation of ovarian tissue. Instead, they're saying just use the unlisted code. On the other hand, 0254T, endovascular repair of iliac artery bifurcation, etc. This was deleted in 2019, but it says they like this one. So they made regular codes in Category 1 for that, 34717, 34718. So 0254T, they liked, 0058T, not so much. It is impossible to remember all the guidelines in CPT. There's so many different ones for each section, each subsection, each heading, each subheading. So here's some ideas as you go along learning CPT. As you go through the books, the sections, be sure to read any guidelines for the sections, subsections, headings, subheadings, and other notes. And underline things, parts that are confusing, and that way and that you know you're going to need to go back to, because that way you can find it easily. Oh, well, that was highlighted or underlined, so I know that was important. Now, sometimes the guidelines are confusing. The wording is kind of funny. What you can do is you can rewrite the guidelines in the margins in your own words so they're clearer for you. I've had some students who have translated the guidelines into their native language and written those in there, which I thought was a wonderful idea. Okay, that completes this video. If you have questions or comments, please feel free to contact me. If you enjoyed this video, please give it a like and subscribe at the picture by clicking on the picture in the lower right-hand corner. And again, here are the books I've written. They're available on Amazon. You can either click on this link or go to Amazon Books and type in my last name, Tropin. Thank you so much for listening. I hope to have more lessons up soon. Thank you.